Bize
Hello, everybody. From the second day of the Marmara Forum, we are together in a very nice session. And we have participants from different parts of Turkey and the world. First of all, we would like to wish you a good day to all the audience. Today, our subject is the urban policies for the elderly, adding value to life. With very distinguished participants, we are going to discuss on the aging practices in urban conditions. Before briefly introducing our participants and guests, I would like to say that the world that we live in is going through important changes that impact their cities. And in yesterday's sessions, we have mentioned them. In particular, demographic and social changes undergoing very fast, and we very closely feel the effects of the climate change. Digitalization, social inequalities are being discussed, and we can notice that the urban life is changing and transforming to a great deal. Right in the middle of these changes, in considering the pandemic of COVID-19, today we are going to discuss the urban policies for the elderly together with very distinguished participants. First of all, I would like to welcome you all. We are going to have 6 speakers. It seems to be a long time. However, we are going to have very short episodes of talk, but I believe it will be an efficient discussion. Now, very quickly, I would like to introduce our guests. A very distinguished researcher from Manchester University, Tin Buffel, is with us. She is the leader of the Urban Aging Group of Manchester, and at the moment, we know that she's focused on social and environmental issues. She has studied on elderly-friendly cities. She has been awarded several times, and at the moment, she's leading a research. I would like to welcome again Mutlu Binark from Hacettepe University is with us from the communication sciences. She's studying on new media, creative agencies and culture. And last year about the elderlies, there was a session together with Professor Özgür. They made a research project about the search of information of the elderly, and they will be talking about this. And at the same time, they have carried out many works with TÜBİTAK, and also she's one of the members. Professor Mutlu is one of the members of Alternative IT institution. The next speaker is Gülüstü Salur. She's a neurologist and she's one of the founders of the Elderly Rights Association, and she's a board member in cognitive neuroscience clinic practices. She's giving courses on those areas, and she is developing training programs in elderly associations. So I'm very briefly introducing all our guests in order to make a better use of time. Another speaker is Mr. Özgür Arun from Akdeniz University, and at the same time, he is the founder of Senex Aging Studies Association, Senex Congress Association, and the magazine journal studies are being carried out. And our distinguished professor is publishing monitoring reports, and also he continues his scientific researches, and he has national and international awards. I would like to welcome and thank you for being together. And while we are in Antalya, I would like to introduce the mayor of Muratpaşa municipality, Ümit Uysal. He is a lawyer, and he's also a member of the Social Democracy Association. And we are going to listen to him about his studies, his works in Muratpaşa municipality. The final speaker is Dr. Deniz Çağlayan Gümüş from Ministry of Family and Social Services. She is the department head of accessibility guidelines, architecture guidelines have been the subjects that she is studying, and Ms. Deniz Çağlayan is also giving lectures in the university. After thanking all the guests once again, because I'm going very quickly, I were expecting to have a broader time for Q&A. For the first floor, I would like to give the floor first to Ms. Tin Buffel. she's going to talk about lockdowns and inequalities during the lockdowns. Tim, the floor is yours. Good morning. Today, I'm very happy that I'm delivering this speech. I would like to thank Murat and everybody else.
And in my talk, which is entitled Locked Down by Inequality, Older People and the COVID-19 Pandemic, I will make the argument that post-COVID-19 recovery strategies need to focus on building back fairer cities and communities, and that this requires a strong embedding of age-friendly principles to support marginalized groups of older people, especially those living in deprived urban neighborhoods trapped in poor quality housing. This is the structure of my talk. I will start with a review of the impact of COVID-19 on older people, talk about pandemic-related neighborhood inequalities, and end with an age-friendly recovery plan for the future of the city. So we all know that older people have been disproportionately affected by COVID-19, whether that was in the hospital, the community, care homes, or at home. But even though older people were actually identified very early on in the pandemic as those most at risk, they have been rarely prioritized in subsequent policies. So in many ways, the pandemic has actually shown a spotlight on groups in our societies. And the virus has in many ways exposed the extent to which ageism and stigmatization of older adults is entrenched in policies, institutions, communities, and the media, and ultimately also in society's response to COVID-19. Older people shielding at home have also faced particular challenges. Healthcare denied for conditions unrelated to COVID-19, higher risks of abuse and neglect, an increase of unemployment and poverty, and the adverse impact on well-being and social connectedness. So in many ways, COVID-19 has exposed and exacerbated the inequalities in aging. And one important issue raised by research concerns the intensification of discrimination experienced especially by marginalized and stigmatized identities in the context of COVID-19. Research in the UK, for example, found that older lesbian, gay, bisexual, transgender, and queer older people were at much greater risk of isolation and discrimination during the pandemic. Research in the UK and France reported that people from ethnic minority groups of all ages had a much higher likelihood of dying from the virus compared to other groups. And research in the US has found that how racism together with ageism are shaping higher risks of COVID-19 exposure and disease, as well as poorer health outcomes, especially for particular groups, including Black older adults. But the coronavirus crisis has coincided with another crisis, and that is a crisis of a long period of deepening inequalities affecting many of the neighborhoods in which older people live. In the UK, for example, there has been a rise, and as in many countries, in deprivation in fact affecting many parts of countries, and an increase in what has been termed ignored or left behind communities as a result of public funding cuts and austerity, which has resulted in a widening of health inequalities. So the pandemic has had a disproportionate impact on such deprived neighborhoods, which were already severely affected by cuts to public services, loss of social infrastructure, and pressures on the voluntary sector. Indeed, COVID-19 is in fact exposing the social and the spatial injustices in our cities. For example, research in the UK found that people living in the most deprived and poor neighborhoods were dying at twice the rate in the first wave of COVID-19 compared with those living in more affluent and rich areas. And similarly, a study of 10 major cities in the US found a disproportionate burden of both infections and deaths in areas with a larger percentage of population living in neighborhoods with higher rates of poverty. So the argument that we make in a paper which is published in Urban Studies a couple of weeks ago is that older people living in deprived urban neighborhoods are likely to experience a double lockdown, suffering the effects of enforced social isolation as a result of COVID-19 instructions to self-isolate, whilst at the same time living in places that have been affected the most severely by the loss of services and social infrastructure. So this paper argues that COVID-19 recovery plans need to focus on building age-friendly communities. And this is a model of the age-friendly city developed by the World Health Organization in 2007, which shows the importance of not just thinking about intervening in the physical environment, such as improving housing, transportation, and outdoor spaces, but also in the social environment, thinking about social participation, civic participation, and access to services. But the pandemic has also shown that we have to go beyond this model and ensure that age-friendly interventions contribute to tackling some of the social and spatial injustices that have been exacerbated by the virus. I think indeed, actually, this pandemic is giving us a really important opportunity to engage in a radical rethink about the future of cities and communities. And I think post-COVID-19 recovery strategies require the integration of age-friendly interventions, but these have to be based upon a citizenship and a rights-based narrative around aging and centered around the values of equity, democracy, and diversity. So translating this kind of just city framework into a couple of action points for a recovery plan for cities, this means that, first of all, we need to invest, and there need to be a focus on supporting the most vulnerable groups of older people and prioritize resources as well as community-centered interventions, especially in the deprived urban areas where many people live in very poor housing conditions and are cut off from social infrastructure and the services that are so important for their quality of life. Secondly, the pandemic has shown that much more work needs to be done to transform the social attitudes towards aging, or combat the stereotypes, the prejudices, and discriminatory practices towards people based upon their age. Actually, every day should be an older people's day, and we need to continue to challenge the dominant stereotypes of vulnerability and passivity, and make, like we did yesterday, the vital contributions that older people make to society, whether as volunteers, as carers, as workers. We have to make those much more visible. Third, given the risk of greater age segregation as a result of this pandemic, it will be essential to foster opportunities and strengthen ties across generations. Fourth, community and voluntary organizations have filled a critical gap in service provision during the pandemic by providing social, practical support to marginalized groups. Whether that was through telephone programs, delivering food parcels, providing information, it will be crucial in the future that there is support for such organizations who often were already in a very precarious position financially before the pandemic hit. Fifth, we need more strategic partnerships amongst public health professionals, local authorities, housing providers, architects, community organizations, and older people in developing future age-friendly interventions. And finally, older people should be at the center of designing such interventions, whether this involves projects aimed at improving digital inclusion, invigorating social and green spaces in cities, strengthening intergenerational bonds, or developing emergency responses plans. It is vitally important, I think, to account for the diversity within the older population, recognize older people's capacities, and harness their experience in rethinking the future of cities. Thank you very much. If you want to read more, this is the paper I talked about in Urban Studies, and you can also find more information on our website. Thank you very much.
The issue of inclusion is the focal point of this study. We have conducted this study together with a team. Duygu Özsoy, Beren Kandemir, and Gülşen Köy were the co-authors of this paper with the support of TÜBİTAK and from Ulak Bey. And this brought us to a discussion about infodemy. And apart from that, we checked the media and the new media repertoire of the elderly. This concept is important because different mass communication tools and different types of media are being used. Apart from that, the issue of digital inequalities, we have benefited from the intersection sociology concept of video, and for this we checked the digital tools and digital skills of the elderly. We measured them, and out of them we have created a digital capital score. And during the pandemic, the situation of digital equality was demonstrated with the new media and new media repertoire. Another subject that we have researched during this study was to what information and to what origins of information the elderly trust. And concerning the information that they do not trust, are they seeking for something? This is bringing us to the participatory citizenship practices. If there is an information which is suspicious for them, do they actively make any complaint, or do they get back to the media institutions? And finally, the connection status we looked into. This is an interaction from Parasus together with media. It's a reference to the lack of social communication. Here we have investigated the different theories of media. I would like to focus on digital inequality issue. I am going to skip the method, the information about the cities of the participants. We can keep it on the screen. Yes. In particular, digital inequality literature. The first digital inequalities is about digital access, and the second inequality is about the skills of usage. When we look at the elderly in Turkey, indeed, the main media repertoire of the elderly is television, and the internet access level is very low. And this, for the gender, and the class and education status is compared, and gender variable and the class origins of the elderly have an impact on the broadness or narrowness of media repertoire and new media repertoire. It also depends on the internet and the usage of the applications on the mobile phone. To own does not eliminate digital inequality. So here comes the second level of inequalities, which is the skills of usage. This is about media literacy and digital literacy. In our study, we have found out that the elderly in Turkey and the skills of usage is also about gender, class origin, and social class. The third level of inequality is the point which is reached by the digital inequality. It's even if we use it and even if we have skills, it's about how to change our lives. And from this study, we can conclude that as the media literacy and media repertoire is low, the elderly feel the need for information, but they have a hard time in accessing the high quality information because the media literacy and media repertoire is low. Their cultural capital is a bridge capital, and it's not a digital capital. If the cultural capital is narrow, and then the digital capital is also narrow and volumeless. Based on the 2017 study of Özgür Arun, There are the classes that have digital capital have a priority privilege in the cultural sense, and most of the majority of the elderly in our society have a narrow digital capital. Even if they need information, they do not have access to that, and this shows that in Turkey there is a third level of inequalities. We can say that in the information from traditional media, in particular on the information about COVID pandemic, the right information level is quite high. But when we ask questions about conspiracy theories, we found out that their level of information about conspiracy theory is that they cannot say that this theory is wrong. So the information they acquired from the traditional media cannot use that information applying to different information channels. Because of time limits, I will not be able to give all the information. We asked which information sources the elderly trust. Mostly they trust the information from public institutions and Ministry of Health, and they are using it as the main source. What attracts our attention here is in particular civil society organization and international organization association trust level in Turkey elderly is low. And this is a subject that civil society organizations should stop and think, because the local governments and civil society organizations can produce different and alternative knowledge for the elderly, and they should formulate policies for elderly. But because of the media structure, media ownership, and we should discuss on that, because in the existing pool media, the information that reaches out to the elderly are coming from the sources which are related with the government, and the civil society organizations cannot be heard by the elderly from national and international media. And in social isolation, the primary source of the elderly is interpersonal communication. Most of them have smartphones and conventional phones, so they can use both of those phones in order to overcome the social isolation. And with whom they communicated, when it comes to civil society organizations and local governments during the pandemic and in the post-pandemic process, in particular about vaccination policies, they can give high-quality information to the elderly using the conventional phones and smartphones. Television is a tool that the elderly is using for overcoming the isolation. Televisions divide the day into sections, and they accompany people at home. For this reason, conventional television is very important in the life of elderly in Turkey. Radio and the newspapers are not being used in Turkey by the elderly. Radio is not an important tool anymore, because public broadcast cannot reach to the elderly via radio. Newspaper, because of the literacy rate and because of not having access during the lockdowns, they do not read the newspapers. But we need to rethink on the role of the television. This one of the recommendations we have received in our presentations was the role of the public television channels in accessing to the elderly. And in our study, we have said that there are channels for children, and there can be a channel for the elderly, which gives information on health or social life or different issues. They can make programs specifically for the elderly, and not only from the public channels. We know that local governments also own television channels, and they produce content for the television, and this could be considered by the local governments.
I wanted to summarize it as such. If we have any questions, I would like to discuss them. I think these projects need to be done vertically. This was done in the first month of the pandemic, and it lasted for 1.5 months. and neither in Ankara nor other municipalities have we seen actually any inclusive or social media application focused or a project which taught them about social media in place. I haven't seen it in my region, and I haven't seen such a contact in actually social broadcasting or public broadcasting. Thank you very much, Mutlu. You've left off at a very good place. Now, I would like to leave the floor to Miss Gülistan from the Association of the Elderly, 65 Plus Elder Rights Association. She will be talking about the practical and field-related aspects as she carries out activities regarding their exclusion. Thank you very much. It is a great pleasure to be here. We know that professors have Miss Professor Gümüş and Miss Koca has very important activities. I will try the content of my presentation if it is very scattered. Sorry in advance, but I am so much full of actually thoughts and concerns. I wear a few hats, as Professor Murat stated. I work with the elderly and cognitive neurologists working with patients suffering from dementia. The 65 Plus Elder Rights Association voices the issues of the elderly for the first time in Turkey. I am one of the founders of this Elder Rights Association, and we have studies on technology, developing, for example, devices and tests for cognitive issues, and also conducting I'm part of the groups conducting activities about the wearables. In October, we started an EU project. Actually, we applied to this project before the pandemic. It's called Digital Inclusion Project for the Elderly. And then we transformed this project throughout the pandemic. I will elaborate it maybe on that later on. I would like to refer to other aspects of the pandemic though. As we wear all those hats, the pandemic has forced us to face three biggest transformations or maybe crises in the world, which actually gave us new responsibilities. What are they? The world is aging. Ecologically speaking, the planet is aging. Our people, our populations are aging demographically speaking, and we see a huge technological transformation and revolution. When we make good use of technology, we can serve the aging planet and aging planet and aging population well. But when we use technology as a tool of new digital capitalism or a tool to create a new economy, then this will exclude the elder population whom we target, and it may transform into a root which may inflict great harm while increasing divisions and fragilities. Let's not allow it to happen, we say. In early March 2020, the COVID pandemic has started, and they invited us to certain television programs. I said, I'm a doctor for the elderly, but I do not have any expertise. And regarding the pandemic disease, then I declined. Then they said, the elderly are under risk. The elderly may die. Let's confine the elderly, they said. And they sat at the center of the topic immediately. And actually, in a sense, not described by everyone, the elderly became more visible. And the entire world, we can separate the groups that reject the disease as a fact, but majority of the world actually refer to passivity isolation, becoming alone, and actually death and illnesses. So that was a window of opportunity for them to establish with the elderly. But we couldn't view that window as it is, because it was sort of a fire. As an association, as a doctor, I shouldered heavy responsibilities, and I drew my lessons and I used them in civil society activities. We tried to communicate them, carry them to the NGOs together with a few colleagues. But because we are not a health focused association, we actually found ourselves as an actor in a health-focused crisis. And with that moment of panic, sliding the curve, as they call it at the beginning, they say, let's not increase the number of patients immediately. Let's make sure that the hospitals meet actually the need. Let's get sick in a slow fashion. That was the sort of approach, asking the elderly to stay at home. And we actually have become a part of this discourse in the first months. Then we have seen actually the separation of the elderly, and we saw that after their marginalization, otherization, we cannot just tackle with the problem with a few months confinement or economic measures. And we also saw that the decisions, also including the young individuals, were given through economic filters. We said this violates the human rights. This was just done to revive the economy. And here the understanding was that we can actually give up on the elderly for economic reasons. This was unacceptable. The Turkish society is very respectful towards the elderly. We say they are very sensitive to the needs of the elderly, we say, and we have seen the examples of irrespectful behavior in that period on the media. We were very bothered by that, and because many people voiced that bothersome feeling, we started to highlight that disrespect of the elderly cannot be accepted, and this was accepted commonly. And here the elderly has been considered as people staying in their corner. They are nourished. We suddenly started to see that we should move beyond the understanding of helping them as they are isolated. Professor Mutlu said something very nice. We started it way before the pandemic. She said it was like a wish for or a wishful thinking for the end of the pandemic. If only we saw the end of the pandemic, we still experience it. And here members of the family, local administrations, central administrations, working for the elderly services and physicians ourselves have been very exhausted. And here we need anchors that can nourish our patients. And here we actually try to draw on our sense of responsibility, saying that we are doing something good, and shove these patients together. That's how we maintain it. We move from person to individual to society, but we should turn from society and look at the individuals to understand how they have been damaged. And we can say that their demands are not that invisible. Who are the elderly? What are the elderly rights? These are the questions people ask me. We have a manifesto for the rights of the elderly. We do not define them based on actually victimhood. We say being a part of the life, being engaged in production, having intergenerational communication, being protected from loneliness, not being discriminated, and having the medical, social, psychological, and economical needs that will respect physical and anatomical changes, and making people feel that they have their own rights, preferences, and that they have the right to live without losing their dignity. And this is a quite comprehensive rights definition, we reckon. So here, Reverend Buffalo made a warning about the title of the session, and I would like to delve into a disputable area now. We started with the perception of oldness, and our association is called actually Elder Rights Association. We do not say older adults. I know how people can discuss it, but I think this approach harms the cause of being elder. If we talk about elderness as a dress people try to avoid, if we show resistance actually to a fine-tuned definition, if we prevent that fragility by our definition from outside, then we are harming that cause. Actually, here, individuals, people who know about the elder rights by having their experiences, and people might say, well, I'm not old yet. I am a young person, still I'm a young person. And then we cannot talk about the old age. I mean, they say, let's make it 75 plus, not 65 plus. Your association's name. Then are we going to make it 75 plus when you become 75? That's what we ask. I mean, pacification of these people, will that be acceptable? This actually care, the need for care and passivity is something beyond age, and we are going to discuss it later. Istanbul Metropolitan Municipality had a strategic actually meeting, and Professor Özgür was a moderator at that table. I was also a moderator at another table, and when we asked the elder people what you want for your age, they wanted nursery, they wanted actually ecological farming land, but they didn't even think of a request that would be legible for the elderly. Of course, they have their opinions about every part of life, but when they voice their opinions, they make their needs very invisible, so much invisible. And then they say, we are not that visible in life. That is a huge contradiction. The science is progressing, the technology is progressing, but we say we don't want to get old at all. That's a huge dilemma. As we get aged, there should be things that can be associated with... Sorry to interrupt you, Professor Gülüstü. We need to wrap up. I also set an alarm, and it rang at the same time. Well, the effort to say that we are still young by seeing us privileged makes this group to be excluded, makes the members of the elder group associated. Let's give the flag to them so that they can talk about their age comfortably, rather than trying to look like young individuals and rejecting their identity. I will now give the floor to Mr. Özgür, Professor Özgür, who will talk about age discrimination as he addressed it in his report. The floor is yours. Thank you very much. Hi, everybody. Now, I would like to share my screen in the meantime. Thank you very much. Miss Speaker, Professor Gülüstü left off at a very critical point. I would like to continue from there. In this meeting, we can talk about the rights violations towards the elderly and discriminative practices as we saw from last year. And I will tell you tell about the sort of discriminative practices based on cases, I will refer to what Professor Mutlu and Gülüstü detailed, as well as what Professor Tina stated. We will be able to find examples, and maybe we'll be able to discuss what general administrations have done so far and what they can do in the coming period. So I think we can also voice opinions there. Also, what the central government has done. Let's look at that, as this session presents a good opportunity to do so. Now, last year, we cannot see your presentation, Professor Özgür. Let me share it once again then. Okay. Yes, we can see now. We say rights violations and discriminative practices against the elderly. This was actually a content and discourse analysis. The study took place between January 2020 and June 2020. Let's remember what happened back then. At the outset of the global pandemic, there was no name for it. We would see numbers, and Turkey would also receive those numbers, and we would actually see findings that discourse adopted by the experts. Then, when the pandemic jumped to Italy, we started to see numbers saying that majority of people dying in Italy were old, and they said that it is because of the older nature of population in Italy. However, when we take a look now, we see as the reason why the elderly are influenced more have something to do with the bad decisions taken by the governments, and even the prosecutors in Italy started in actually certain legal proceedings about the decisions taken by the local authorities or prosecution there. When these stories reached Turkey with a protective approach, it was said that the elderly should stay in their homes, should not go out to streets, they should frequently wash their hands. We tell three groups what they need to do a lot: children, women, and now the elderly. We tell these groups what they should do and what they should not do. It is dictated, actually. That's what we saw in this group. And on 23 of March, the Ministry of Health published this directive, which actually prohibited the young individuals from going outside for an indefinite time. That was actually a worrisome development for us and for Senex. And there was this actually warning declaration or press release. We said that this can hinder the rights of the elders and even cause conflicts between generations, consolidating ageism, and cause attitudes to turn into behaviors, and stock actually discrimination there. If we are going to see prohibitions, there should be time limitations, we said. Of course, the governments might do it in times of urgencies, but there should be an inspection there, an audit there. I mean, there should be definitions about the right mechanisms so that they are not damaged, and there should be time limits. However, in the world, we have not seen a country other than Turkey which actually limited the elderly without any time period. And as you would remember, that also applied to young individuals aged below 18. It was a huge lockdown. I think two elements were quite unsuccessful during this period. One of them is NGO, because after Senex made this warning, we have not heard of any NGOs, and Professor Gülüstü also criticized that, and also she made a self-criticism. And that was a very saddening development, because the human rights associations in Turkey were unprepared in terms of aging. That was one of the most striking aspects. Second failure was related to local administrations in Turkey. Nevşehir municipality, for example, started this practice, as you would remember from Twitter. They said you can call this number to report on them, to report on the elderly people if you see them on the street. Also, Anatolia Agency, news agency said that drones are used to limit the elderly from going to the streets. So they turned into dangerous people and they were criminalized by the ministry. And this wrong step taken by the central government was owned by the local administrations, unfortunately turning the discriminative attitudes into behaviors and even a hatred of the elderly in the society. Now we have been carrying on activities about age discrimination, and we look at the trend in Turkey before 2019. Actually, 7% of these individuals were suffering from age discrimination. And here there is this third period, the research which tells about the frequency of discrimination, and it says that they suffer from multiple discrimination. Antalya elderly discrimination research starting with 2013 says that the age discrimination is on the rise even at a local level. This vertical study shows that it rises from 4 to 11%. And in the pandemic, let me describe what kind of discriminative practices has this rise led to. But before that, let me tell you about the use of the words like old and getting older. As you would remember, one of the most frequently used words was virus. As an elderly was stopped on the street, they made them put on a mask, and someone even poured cologne on top of them. They used the words like put on your mask. They said nanny, they said daddy, they said stay at home, they said you are dangerous or risky, and they were associated with chronic diseases as well. Let me refer to the sort of discriminative practices related to news stories, but they point to cases. They refer to cases. First, the right to travel was actually prevented in Turkey a certain extent. This huge company doing international travels said that they will not accept individuals aged 65 plus to flights. And Ankara, Izmir, Konya, and metropolitan municipalities like that deprived the elderly of their travel cards. And they were prevented from having inter and intra-city travels. As you see, the elder individuals were forced to get off the bus. This is a female example, this is a male example, and they are trying to prove that they are not 65 plus. Unfortunately, they were criminalized and forced by the police to hop off the vehicle, and they were deprived of their travel rights. Second striking example was about their access to justice. They were prevented from going to law courthouses. However, we know that both international conventions and our laws say that someone's access to justice cannot be prevented. Someone needs to defend themselves if there is a blame put on them. They need to be able to find out. They need to be able to seek legal remedy. Unfortunately, they were prevented from accessing legal right. The third striking outcome is that they were deprived of their right to work. We know that the people in the agricultural sector are older individuals. These two cases show that on a local level in different cities, these elder individuals were prevented from working with the practice of law enforcement. This is one of the very hurting news stories, one of the very striking news stories about the prevention of civil rights. An elder couple were prevented from having a legal wedding. Actually, our constitution, international conventions say that every individual, be it old or young, have the right to uh, have a marriage contract. And as you know, our government, through social responsibilities, support the concept of family. They even sanctify the concept of marriage. But you see that this striking example demonstrates their deprivation of that right. All the this example is about the prevention of rights and care, health and care rights. These elder people were said to not be accepted to the nursery after receiving treatment, and that some elder individuals were sent back to their houses as they set out for hospital for treatment reasons. Let me finish with a few examples. I know that I've run out of my time, but let me say that local administrations should definitely look at rights-based services rather than needs-based services when they plan actually rights for the elderly. There are very few number of local administrations doing that actually. We are going to listen to one. Mayor Ümit Uysal will be telling about that in this session, but the decisions to be taken by the local administrations may prove very effective for the elderly. So the elder individuals and their families needing care should be strengthened together with the family members. And any ban on chronological age should not be limiting for these services. The central governments might take those decisions. We're trying to force the way there, but the local administrations should take their emergency actions, and also they should develop a perspective about comprehensive services. And on a national scale, Turkish Statistical Institute must definitely include an aging research in its official statistics program and it is actually obliged to provide those information to us. Let's put pressure. That is a request for people listening to us as well, so that just like in England, just like in Canada, just like in other capitals of Europe, we conduct a research about the aging map in the country. Also, we must definitely establish Turkey National Aging Institute. You can access openly these publications as well as the book through the Senex website. This was supported by the European Union. I would like to take the opportunity to thank them. Thank you, Professor Özgür. Now, let me provide a piece of information to you. Turkey Aging Survey research is being conducted at Istanbul University. How can we conduct this study? We can pay attention to the examples in, for example, the United States, in Europe. That's how we started our survey study. I definitely support your recommendation on that. And now we will give the floor to Mayor Ümit, as Professor Özgür referred to rights-based services. So we're going to listen to the perspective of local administrations. The floor is yours, Mr. Mayor.
I would like to extend my respect to you all, and I would like to thank Özgür for his kind remarks. And elderly population density is going up all over the world, as well as in Turkey. Older than 65 population rate is 10% here in Turkey, in this region, in Muratpaşa. We have 51,000 people in Muratpaşa district. We need to take up an attitude for this. Actually, concerning the elderly population, what we are going to do should be on the universal right basis. Everything must be right basis, and it should be inclusive. We shouldn't pretend as if we should not make a symbolic project with 15 people. We should be genuine. We should be authentic. So we thought what we could do specific to here. And right-based approach is an expensive thing. You have to make a big operation for arranging the physical conditions, and we are starting. All the cities start from an very backwards position. You need significant practices. You need to strengthen your social services in terms of equipment and in terms of personnel. So this should be planned very significantly, and you need to allocate resources, in particular if the population density is high. For this reason, it's economic, but the impact is very high. The marginal benefit should be very high in our activities. We have developed a model for the elderly homes since 2014. That means the elderly people go out of home. We have made many areas on the seaside as elderly homes and good, nice green areas. They become a member of our elderly homes. They come and socialize there, and they can get any training they would like, and they can live in a constant partnership with other elderly people. It is open to the membership of anybody. When you take them out of home, there are so many reflections. Generally, elderly people have a negative interaction with women labor. In this sense, this is a specific, original, and very useful work. Apart from the allocation of the area, it doesn't cost very much, but we have arranged it as a preventive Alzheimer services, and we have been obtaining support from the experts at all times. Right after that, this was closed. We had to close it down during the pandemic. And people kept asking when it would be open, because it was a very important socialization and social service receiving environment. During the pandemic, we had to close them down. Our social service had an orange table organization, which makes us accessible. The citizens can directly have access to the services. According to the interactions with 60 elderly people, we have initiated the Assembly of the Elderly, and it was in 2016. This elderly assembly was kept meetings throughout the pandemic. They participated in decision making during the pandemic, and they participated to decisions about budgeting, and they kept saying their words about all the other subjects which relate to them. And the quality of our social service has changed during the pandemic. This service of bringing food home, there were some needs. It became more because of the lockdowns. So the mobile service became more active and dynamic, and we brought the services to their homes. And for people who couldn't move from home, we have a home care service, and we have patient transfer services. Mostly elderly people are benefiting from that. So this is a broad social service. At this time, we have added new stuff to that, and we had to improve it during the pandemic. Actually, many decisions we have taken in the beginning was for weak bodies, low resilient, non-resilient economic structures were there, and they were most vulnerable groups. If your economy is weak, or if your biology is poor, you are more affected from the pandemic. And first decisions had been taken about the elderly, but later it turned to something else. While implementing it in the field, while citizens were interpreting them, police force were interpreting them, they were not perceived as if they were perceived as if the elderly were spreading the disease. But actually, the case was to protect the elderly, and we have experienced very problematic behaviors, which were mentioned by Özgür in his presentation. I think that is a bad development, but with regarding the equality between age groups, there's a positive aspect. In general, in the pandemic, the mobility has gone down, and people were working from home all over the world. It was a developing way of working, and this somehow equalized the conditions of age gaps. The mobility was restricted in general, and for this reason, the elderly people had a broadening in services that could be invited to home. But this is just a small benefit, and children and the elderly were the people who were affected at the highest level. Thank you very much, Mr. Mayor. I'm sure some points will be opened up. Özgür Hoca reminded that Muratpaşa municipality is a member of the elderly friendly cities, and we have emphasized that the elderly assembly is unique in Turkey. Now I would like to leave the floor to Çağlayan Gümüş. In her presentation, Ms. Deniz will focus on the perspective of the elderly, and before the pandemic, what is our position about the design, urban design? The floor is yours. Thank you very much, Professor. I would like to extend my respect to all participants. Yes, when we are talking about city policies, I'm a city planner, and professionally, the spatial dimension is very, very important during the pandemic, and in general sense, spatial arrangements are very important for all city dwellers, and it is a sine qua non. Accessible environments is a must. In this sense, I would like to share one presentation with you. Yes, accessibility, which is a structured environment being usable for everybody. I'm going to give some information about that, and during the pandemic in particular, some problems were encountered, so I would like to mention them, talk about them in my presentation. 2020 was the accessibility year, and we had organized accessibility awards, and we have a public spot we have shared for this program. I would like to share that with you. Accessibility is the right of everybody. Access to life is transportation, education, communication, work, produce, equality, participation to social life. Ali going to school, Ayşe going to sports, Necla going to the park with her baby. It's eliminating barriers. It's destroying barriers. Life, access to life is being aware. Access to life is right of everyone. Just for this reason, in order to create the culture of accessibility for a life in accessible Turkey, we are here all together. In the scope of accessibility, elderly city dwellers People with the problems of mobility, they are our target group, and they are an important population that we want to keep in the forefront. While talking about urban policies, WHO in 2005 initiated the project of age-friendly cities. In the scope of this study, all city dwellers' level of participation in life and life quality shall be increased. And in order to eliminate the barriers, the target was to spread the urban design which addresses to the needs of all. There are some measures identified for this end. In particular, the structured environment in the buildings, components, and outer spaces should be accessible and without barriers. With regards to transport, the pricing, safety, accessibility, transport vehicles should be put into service. About housing, the houses should be ensured for everybody. For social participation, there is a need for interaction between generations. In our country, we have refreshing universities. This is a study. Respect and social inclusion is an example to that. Civic participation and labor life, in particular after retirement, keeping to be a reproductive person, communication and information. During the pandemic, in particular, electronic literacy shall be ensured with supports. Media services should be used. During the pandemic, access to information has become very important, and social support and the access to health services, in particular home care and elderly people receiving help from support from municipalities or other public institutions. We can talk about those kind of measures of age-friendly cities. The goal is to ensure that people get aged in an active way, and they should be supported for this end. When we look at the structured environment, as the age going up, there are some problems about reading, in particular in spaces while traveling from one point to another, or when we present an informative service about COVID-19, the tools must be usable. And again, there are some hearing difficulties. It could be during the transportation, or when we are doing a voice information. There shouldn't be any background noise, etc. There are some problems about mobility. It could be about climbing the stairs, or heavy doors, heavy gates being opened difficultly, or there could be some accidents because of falling on the ground. And leisure spaces must be ensured to be used when people get tired of walking. Finding direction is actually causing the chaos. And so when people are confused, there must be decorations and equipment so that people can find their direction. Security is important. There must be warning sensors, in particular indoors, in case of danger. For example, if the gas is left open or water is left open, the necessary information should be given visually and audially. Now here we are talking about the spatial accessibility. When we are talking about in city planning, this is an important actor. However, for livability, it's necessary for people to go out. And to go out, the most important condition is accessibility. Accessibility is defined as everybody can safely and independently reach anywhere and any service. We say everybody because in the society, age, gender, because of loss of function, people have very different needs in access to information. For 15% of the population, it's a must to have accessibility. And when we are talking about elderly, it's necessary for 40% of the elderly. But for 100, it means a comfortable life for 100% of the population. When we are talking about access to everywhere and every service that is required, everybody, including the elderly, should have the right to have access to any service in any point of the city. And we need to ensure accessibility in transport. And safe and independent usage is very important. Without the need of any person and without any risk of accident, the cities should be usable. Accessibility is handled in Turkey in the scope of the law about the persons with disabilities, and starting from the planning stage in the cities, design, construction, manufacturing, licensing, and monitoring processes should be in line with the accessibility standards. And according to law, all the spaces open for public use must be accessible, and we have websites for the access to information, and for the structured buildings we have certain standards. According to law, we have transportation services. In Turkey, we have free of charge transportation services in city, but in both within the cities and in the entire city or tourism transportation services, accessibility is a must. So if necessary, as we are talking about everybody, if necessary, the elderly should apply to the public agencies, and there must be a commission where they can share their problems. And they are using the checklists that we have identified. If we are visiting a place which is accessible, we provide a certificate. And in these audits, we also pay attention to the needs of the elderly people. In 2019, we have prepared a study, and we have prepared a guideline for the accessibility. And for the elderly users, the structured environment should care for the needs of the aged population, and architects, practitioners, municipalities who give the licenses can benefit from those guidelines. In order to use my time efficiently, in my presentation, I only had a brief presentation. People with mobility restrictions, during all process, accessibility must be part of the urban policies. In particular, the local governments should should give it as a right, and this must be a it must be a must right. I would like to thank to all participators. We have about 12 minutes time, and I believe that we are going to make a good discussion. Probably we will have questions to ourselves or to the participants. Denise has drawn the framework, and she said there are some public laws which are paving the way for these changes, but maybe we need to talk about the practical dimensions, to what extent they can be applied. And if we have questions from the audience, I'm trying to follow them. So I'm going to give the floor to Ümit, the mayor of Murat Pasha. You are practically experiencing this framework, so what would you like to say about that? We can start with the questions and discussion part. The floor is yours. Ümit Bey, would you please turn on your microphone? What kind of difficulties and facilities are available in practice? Okay, thank you very much. The city's spatial accessibility is requiring a very expensive and deep-rooted infrastructure. So it requires a very long preparation process, and it's a need. In the world, I believe there are not so many of them. In Stockholm, there was such a work which was carried out for 12 years. We should take all the city, and we need to test the physical accessibility on every street, on every home. It's a very comprehensive job, but when it comes to social services, if social service accessibility can be arranged in an easier way, but that requires a high amount of personnel and equipment, and that requires a significant budget. But we can start from one point, or as we have done, you can use a small budget which in order to provide a space and models which will create a high benefit with a low budget. So the elderly comes very later, in particular in our country. First, you need to violate the laws, then the laws can be corrected. We have a lot of examples like that because lawmakers cannot act as fast as the real life. Or a law comes from a different part of the world. It's a very abstract and rounded law, and nobody can obey those rules because of lack of physical conditions or economic conditions. So the legal arrangements, I do not want to be misunderstood by the representative of the ministry. I'm talking about a general attitude which has been ongoing for long years. So I'm not very hopeful about the legal arrangements. For example, elderly homes. Can be arranged for every district, but the lawmakers do not make this a compulsory practice. First, the model of the elderly homes should be developed, like the case for the women shelters. We need a long time in order to reach there, so the local governments should come up with creative, innovative, dynamic ideas using their budget in a correct way. They can open up the horizon of general public management so that they will not be static, and then the general public administration will change the laws. And this is the case for most parts in the world, not only in Turkey. Life is ahead of the laws. Thank you very much, Mr. Mayor. We are running out of time. So may I ask you all to give very short answers to the questions. We have some questions for Denise, but please be very brief in responding those questions. Our professor, in particular about digital literacy and digital capital, I was asked about the works of the ministry in these subjects, As far as I know, in the scope of the elderly support program, we have a budget program. We have a budget for this program, and in the scope of this program, some studies are being done for digital literacy. However, I do not know the details. When we pass to the accessibility practice of local governments, if my intention and plan is to make a city accessible, and we have examples of that from Barcelona and from other cities, but the municipality should make every new building, every new piece of stone should be made in line with the accessibility standards. I think that's much more suitable, and we are ready to provide the sufficient support to municipalities as the ministry. I have a question to Tyne Buffer. In particular, she has talked about a double lockdown in her presentation. Before, when we consider both pre-pandemic and post-pandemic conditions in overcoming this lockdown, what about the civic participation? For example, for ethnic minorities, how can we overcome these lockdown barriers? Yes. Could you hear us, Madame Buffel? Ah, soru bana mıydı? I would like to ask about civic participation, in particular in the process of double lockdown, in particular from now on in the future, in this kind of crisis periods, it's important. What can we do for increasing the civic participation with regards to ethnic minorities? Çok kısa bir şekilde cevap vermek istiyorum.
Older people in Manchester in different phases of the lockdown with different ethnic community older people. And what this study has shown is, in fact, the importance of investing for the future in social and in green infrastructure in cities. Because social infrastructure, community groups, spaces where people feel safe and can meet other people, have voluntary engagements, have proven to be one of the most important things that people missed. And I think alongside thinking about a future with reducing digital inequalities, I think it's very important to also recognize that for many people, actually, personal contact and seeing other people, meeting other people in green and social spaces within cities is very important.
Teşekkürler. Thank you very much. Diğer taraftan katılımcılarımızın sorularına da bakmak istiyorum. Bu arada
Also, I would like to check the questions of our participants. There is another question I would like to raise. We're running out of time actually. In particular, I would like to ask this question to Professor.
So the new developing technologies we said, and you have highlighted television. Here, as for the applications and other relevant innovations, what can we do in terms of innovation? Let me ask this question for you. Thank you very much, Professor. As Tina highlighted, green social environment is important with the climate change, and we need to develop a policy that will overcome digital shortcomings, and we should not ignore the role of the traditional media, including television. This is a reference to the whole world. Even in the Netherlands, television is the main communication tool. Even for China, and 2021 research shows that television still plays an important role. But, for example, the most recent research in China, a vertical one indeed during COVID, shows that as an information source, television matters, but more commonly, actually, old people use less smartphones. But with COVID, contact and monitoring applications require the use of smartphones, and now the elderly people own smartphones. The public policy, therefore, encourages the local administrations. And here, my recommendation for the local administration, starting with the metropolitan municipalities and even the union of municipalities, is that they can send information through applications on a local scale. I can give an example from Ankara. Ego hours, transportation hours, can be downloaded to your smartphone. Ankara Metropolitan Municipality has this application, and whereby you're able to learn the weather conditions, learn about the public bazaars, public transportation. So this application can provide elderly related information as per the requirements, and it doesn't suffice to develop an application. We should teach them how to use it. I mean, the secondary use capability should be overcome as an issue. The elderly in Turkey, according to the findings of our research, own mobile phones, but that doesn't necessarily bring about skills to use those smartphones. So we should mobilize all the people, and I think the traditional media is a convenient tool. Sorry, Professor, we're running out of time. I had to interrupt you there as we have only 30 seconds now. Actually, I'm quite aware that this is not enough time. We have plenty of things to discuss, but I would like to thank each and every one of you for accepting our invitation. I would like to thank you on behalf of Marmara Union of Municipalities. I would like to thank you for your contributions. Hopefully, we'll be having a face-to-face meeting in 2 years' time in the next forum. I wish you a very enjoyable day. Bye-bye.